Good morning. This court will now come to order. Clerks will call the roll.
Glenn Whitley, County Judge.
Here.
Willie Charles Brooks, Commissioner, Precinct 1.
Present.
Devin Allen, Commissioner, Precinct 2.
Here.
Gary Pickus, Commissioner, Precinct 3.
Here.
J.D. Johnson, Commissioner, Precinct 4.
Here.
Constitutes a quorum.
This morning's invocation will be given by Chaplain Frank Leideke. Please remain standing for the pledges of allegiance.
Father, we thank you for this time that you have given to us. Lord, we ask and we pray for our country at this time. We pray your blessing on it. Lord, I pray that you would keep folks safe. Lord, I pray you give wisdom to the commissioners and the judge as they lead, as well as the sheriff, his staff, the officers at the Correctional Institute, as well as those around the street. Lord, we especially want to thank you today for the volunteers, the folks that have volunteered as chaplains, some of them many, many years, and their faithfulness. Lord, I pray that you bless that, and I thank you so much for their consistency. Bless them and their families. Thank you for this time, and we pray your blessing on this. We ask in Jesus' name. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Thank you, Chaplain. Good to see you.
Mr. Manius.
Thank you, Commissioner. Just a few announcements this morning. First one, as it relates to the agenda, deals with the Budget and Risk Management Department. This will be item 8C1. This is the FY21 appropriation adjustments. We made a correction on that. It is a consent item. It was a corrected amount that was donated to the county by Direct Energy. I think the initial one had a $10,000 contribution. It's actually a $6,000 contribution. We've made that change.
All right.
Also, members of the court, as we've done in the past, we're going to take certain things out of order. When we get to the administrator section, we're going to ask Ms. South to make her initial high-level presentation. We're then going to ask representatives from UNT Health Science Center to come forward and make their presentation. And then we will also then move to a briefing item very quickly and have Mr. Snazian make his presentation, very similar to what we've done in the past. And it's all covered by item number 1 and also the briefing item. Thank you, Commissioner.
Thank you, Mr. Manius. Proclamations and presentations. Let's have your announcements first, Commissioner Allen, if you don't mind.
Well, first off, just wanted to share, as I'm sure everyone has heard, that we are, yesterday was the start of early vote for the May 1 joint general and special elections. There are a number of races, particularly in Precinct 2, that will be on the ballot. So, of course, we want to make sure that people go out and make their voices heard in this election. Second is on Wednesday, April 21st, so tomorrow, we will be hosting a town hall on the Emergency Rental Assistance Program, the new one, here at the county. Joining me will be Judges Mary Tom Kernut and Kenneth Sanders, as well as Kristen Camarino with our organization, and Mindy Cochran with the City of Arlington. So this really is a great opportunity if you are a renter, if you know a renter, if you're in property management, if you are a property owner. A really good opportunity to ask questions of a host of folks who are serving this program. That will be on Facebook Live from 6 to 7 p.m. You do not need to have a Facebook profile in order to view it. So again, tomorrow from 6 to 7 is a town hall on our new emergency rental assistance program. Thank you, Commissioner.
Thank you, Commissioner Allen. The first proclamation is for National Crime Victims' Rights Week, and I'll read it into the record. Whereas, being a victim of crime and navigating the criminal justice system can be a frightening and confusing experience. And whereas, since the passage of the Victims of Crime Act of 1984 and through the decades of work by advocates, lawmakers, and victim service providers, there is a growing array of services and resources available to victims and their loved ones. And whereas, honoring the rights of victims, including the rights to be heard and to be treated with fairness, dignity, and respect, and working to meet their needs rebuilds trust in the criminal justice and social service delivery systems. And whereas National Crime Victims' Rights Week provides an opportunity to ensure that accessible, appropriate, and trauma-informed services are offered to all victims of crime. And whereas Tarrant County is hereby dedicated to supporting victims and survivors in the aftermath of crime, building trust among our citizens, collaborating with service providers, and engaging our community in response efforts. Now therefore be it resolved that we, the Commissioners Court of Tarrant County, do hereby proclaim the week of April 18th to the 24th, 2021 as Crime Victims' Rights Week in Tarrant County, and reaffirm our commitment to creating a victim service and criminal justice response that assists all victims of crime during this week and throughout the year, and expressing our sincere gratitude and appreciation for those community members, victim service providers, and criminal justice professionals who are committed to improving our response to all victims of crime, to find relevant assistance, support, justice, and peace. In witness whereof, we have hereunto set our hands and caused the seal of Tarrant County to be affixed this 20th day of April 2021. And I move approval.
Second.
Please vote. Judge Whitley.
Yes.
Commissioner Johnson.
Yes.
Commissioner Fickus.
Yes.
This proclamation passes unanimously. Here to accept this morning is Lori Clarida, Victims Assistance Coordinator with the Sheriff's Office. And I'd ask Lori to join me at the podium.
I'm good. How about yourself? Good.
morning.
Morning.
Good morning, Judge. Good morning, Commissioners. Thank you all for having me. And Commissioner Brooks, thank you once again for sponsoring the proclamation for National Crime Victims' Rights Week. The Tarrant County Coalition of Crime Victim Services, who is comprised of law enforcement agencies, the DA's office, and many, many social service agencies in our communities, come together once a month, and we still have been meeting virtually throughout the pandemic. And we come together every April during Crime Victims' Rights Week to honor our victims. And this year we are having our 18th annual tribute to victims. Our presentation will be tomorrow at 3 p.m. via Zoom. Commissioners, you all got an invitation from me yesterday. I will leave another written invitation in your boxes today. With that information. Commissioner Brooks, I understand you are joining us and reading the proclamation for us again tomorrow. Thank you. So if anybody else would like to join us, please get in touch with me. I do work here in the Sheriff's Office. I'm very easy to get in touch with. Send me an email, call me, leave me a message, and I will certainly get everybody that Zoom information if you would like to attend.
I understand that CDA Sharon Wilson is on the program as well.
Yes, she is. Thank you.
Thank you for all you do, Lori.
Thank you. Thank you very much.
Let me go back and ask for approval of the minutes of the regular meeting of April the 13th, 2021.
Move for approval.
Second.
Please vote. Judge Whitley.
Yes.
Commissioner Johnson.
Yes.
Commissioner Fickus.
Yes.
Thank you. Back to the proclamations, resolutions, and presentations. Now we come to a celebration of the Tarrant County Jail Ministry. We've got several volunteer chaplains who we will recognize this morning, and I will ask Chaplain McDuffie if he will come forward and introduce this topic for us this morning.
Good morning.
Good morning, sir.
It's a beautiful day.
Indeed.
Wherever we are, it's a beautiful day today. Thank you for allowing us to come forward and present to you the volunteers of the Tarrant County Sheriff's Office Jail Ministry. Ladies and men has given so many hours to this program. At present, we're sitting at about 260 some odd people that comes in and minister to our inmates. We tell people all the time it's a detention center. Everybody hadn't been found guilty yet, so everybody have a right to have a second opportunity to get it right. So these people come in and do this every week. And today we have with us at least 12 of them that's upward from 25 years to 43 years of service. And as Reverend Tyrone Gill would say, they give us their most precious commodity that any man could ever have, and that's their time. They spend their own money for parking, for material, and their own time to take care of our inmates here in Tarrant County. And for that, sir, on behalf of the sheriff and the entire staff of the Sheriff's Office, we thank you for acknowledging our volunteers.
Well, we certainly appreciate everything that the volunteer chaplains do for Tarrant County and for those who they touch in our county jail. Chaplain, the plaques are right there in that box. If you would move it into a convenient spot.
Do you need a mic?
No, sir.
Sheriff, come on forward.
You have to ask.
Not present with us today, I have to mention John Foster. John Foster has 43 years volunteering with the Tarrant County Sheriff's Office. we have Willie Martinez. Willie Martinez has 40 years as president. Come on up, Willie.
Mr. Martinez, come on around the circle there. We'll get a group shot when we're done.
Next we have Sam Tucker, 39 years. Sam looks better today, he got his wife with him. Nolan Denmark. 34 years. Marvin Marks. Marvin has 33 years. Ronnie Robertson's one of those trusted teachers who can't be here today. He's in the classroom taking care of our children. Ronnie has with us already 31 years.
Amen.
Now we have the one and only Shirley Graves, 31 years. Now Shirley is very interesting. Shirley lost her feet in the jail. Both of them. She has prosthetics and she's still coming in to help get our people together to go up and serve. She has nothing but our life. Already got now. Every bit of 28 years. Tom Shepard, 28 years. Praying for you, Tom. Private, you gotta go in the cell. Gotta lock you down. Tom Mueller, 27 years. All right. Anthony Tony Ramirez Jr., 27 years. JJ, Jimmy Jenkins, 25 years. Now see y'all in the sheepfold, right? Sharon Matthews. Sharon has 25 years. Sharon had made it. Last but not least, coming from who allowed us to have them put these plaques together, and here's what it says for all of them. In recognition of appreciation of 25 for Eugene, 25 years of loyal, valuable service to the Tarrant County Jail Ministry Program of Tarrant County, Texas. Our best wishes and heartfelt thanks accompany this expression of gratitude. Truly, truly, I tell you, whatever you did for one, the least of these brothers and sisters of mine, you did for me. Matthew 25 and 40. Come on down, Dave. Come on up, Miss Shirley. Can you make it to Shirley?
I ask that, I move that we receive and file this presentation.
Second?
Please vote. Judge Whitley.
Yes.
Commissioner Johnson.
Yes.
Commissioner Fickus.
Yes.
Truly, this is a Matthew 25 ministry, and we appreciate all of you for your years of service to Tarrant County.
Oh, they need to stagger? Okay, come on like this. We're gonna set you right here, Willie. Right here. Come on, a little bit. Dave, come on over here. Come on out. Sam, go in that hole there. All right.
Lucky me.
Yeah, gotta have a tall drink of water there. Okay, yeah, we'll come over this way a little bit. Right there.
Commissioner,
Good. Come on. Oh, we got a slide like that on there. Slide on down.
You missed your call. You should have been a photographer.
How's that look?
Ellen, can you read it just a little bit? Yeah,
Keep
good,
early.
good. You're covering up the beautiful one behind you. Sure. So, you're gonna, yeah, we're gonna have to.
Come on,
sit you down.
Sam.
Thank you,
Good.
thank you.
Yes, sir. By the road.
And there's three.
My hair right.
Perfect.
One more for the sheriff's office, please.
Okay, thank you.
All right, thank you all. Praise the Lord. Thank you very much. My love. Thank you. The voice of God, so leave the building.
Only he would do that.
Commissioner Brooks, Commissioners Court, thank you all very much for that recognition. Hundreds of years of experience. The heartbeat of a volunteer is such a pure thing, and their service to our jail is incredibly valuable, that they're reaching people who have no hope and giving them hope every day. And I may add that the majority of those people that you saw here, at one time or another, they're praying for each county elected official and appointed officials in this county all the time. So we have thousands of hours of prayer going up for us each week, and I contribute that to our success in Tarrant County. Thank you, and God bless.
Thank you, Sheriff. Commissioner Allen.
Yes. So April is recognized as Black April Memorial Month. And April 30th, it marks the 46th year since the fall of Saigon to communism. I will not read this proclamation in its entirety as I will be presenting it at a community event this Saturday. Oops, somehow my mic was off, sorry about that. But with that, I move for approval.
Second.
Thank you.
Please vote. Judge Whitley.
Yes.
Commissioner Johnson.
Yes.
Commissioner Fickus.
Yes.
Proclamation passes. We have a proclamation from Commissioner Fickus recognizing Grapevine Main Station. It's for ratification only, correct, Commissioner?
That's correct, Commissioner. And I move approval.
Second.
Second.
Please vote. Judge Whitley.
Yes.
Commissioner Johnson.
Yes.
Commissioner Fickus.
Yes.
Passes unanimously. Commissioner Johnson, you have a proclamation for National Osteopathic Medicine Week.
Yes, it's for ratification only. I'd move approval.
Second.
Please vote. Judge Whitley.
Yes.
Commissioner Johnson.
Yes.
Commissioner Fickus.
Yes.
Passes unanimously. Commissioner Allen had suggested this morning that I try to figure out how to mute your mic sometime during the meeting.
Did I say that?
I'm not that technically savvy.
Well, I really told you that you should have started without her because there was enough of us over here, we could have started without her.
Oh, that's not nice.
Moving right along.
Move approval of the consent.
Second.
On the consent agenda, we have a motion and a second. Please vote. Judge Whitley.
Yes.
Commissioner Johnson.
Yes.
Commissioner Fickus.
Yes.
Passes unanimously.
Uh-oh, our attorney's speaking with Mr. Manius. We're in trouble.
Mr. Manius.
Thank you, Commissioner. We're now going to move to the administrator section, and we're going to begin with the overview by Ms. South.
Good morning, Megan.
Good morning. How are y'all?
Morning.
Okay, let's get started. It's weird just seeing two of you up here. Let's get started with our pillar slide today. Maybe. There we go. So under our first pillar, we are continuing to see testing numbers decline at the TDOT-operated permanent sites. But we will continue to monitor the numbers and any closures that might occur on a weekly basis. Any new information I know is being sent to you all by Jessica Mason in our emergency management department. Since the summer is approaching and NRH2O is one of our permanent sites, they obviously want to open their doors. So that testing location is currently in the works to be moved to the JPS clinic off of Brown Trail in Bedford at the end of this month. So JP Elder and TCC Southeast will remain and continue to operate hopefully into May. But again, that will depend on the numbers, which we will evaluate weekly. And if something is closing, we will notify you all as soon as we know something. So exciting news under our social services pillar for the 2020 CRF Rental Assistance Program. Kristen notified me that it has officially closed and is complete with over $8 million paid out, and it was able to assist 2,413 households. The 2021 Federal Emergency Rental Assistance Program, the new one, is running smoothly, and numbers are included in the weekly report that you receive from Redmond. But approximately 239 applications have been successfully completed and submitted as of today. So moving on to our vaccination efforts update. Even with the pause of the J&J vaccine, as you can see from the numbers on the slide, they continue to steadily increase, and that's both for Tarrant County and its partner entities, including JPS. UNT is here today, so I don't want to go into too much detail for their portion, but I will briefly touch on the opening of the indoor Ridgemar Mall vaccination site. That is scheduled to open tomorrow, April 21st, in the space that was formerly occupied by H&M. And that will operate from 11 a.m. to 7 p.m., so it'll give a bit more of an opportunity for people who work late or whatever the reason may be to get there and get their vaccination. And moving forward, that will be open Tuesday through Saturday.
What kind of signage will we have directing people to the proper place?
I imagine it will be something similar to what we have at the other locations, but David or Sylvia might want to talk about that when they get up here.
Okay, thanks.
UNT is also working to secure an additional vaccination site in Arlington, and they're continuing to hold registration drives throughout the county. So they're working hard and we're moving forward. Also, direct appointments are available like we talked about last week. You now have the capability to scroll through and find a location, register for a specific time block on there. I know Vinny talked a little bit more in detail about this week, but last week, but staff has been working with UNT and Public Health, and just yesterday, the site is Tarrant County /vaccine finder. Got that up and running, and this site has all vaccine locations, Tarrant County, UNT, all sites. It has a little map. It's very nice. It's very easy to use. You can scroll through. Tells you all the information you could ever want to know about all of the various vaccine site locations. This link will be located on that Tarrant County Strong page, so you'll be able to click on it and it'll take you back to the site that was created for that specifically. Any questions on vaccination update slide? Good.
Megan, does that location allow, you said it's sites, does it allow you to go ahead and make a reservation for a specific time and a specific place?
I didn't hear the last part, but the answer is yes, sir.
A specific time and a specific place.
Yes, sir, it does.
Now, when we talk about time issues, they're in 1 hour blocks.
Correct.
But again, if I wanted to go to the Hearst location on Thursday of this week between 1 and 2, as long as that time is available, I could click on that, make the reservation, and at the same time register and fill out all the information either now, or if I didn't do it now, I could do it when I got there.
Yes, sir. That is correct.
I think we really need to emphasize that, and I would ask that, Bill Hanna or whomever, that we get that word out to everybody, to all the radios and television stations, and really see if we can't push that forward.
Sure, and hopefully when UNT talks, they'll talk a little bit more in detail about their marketing campaign. Okay, next is your just your map for historical data purposes, but as you can see, Precinct 2 is back in the lead this week by call volume by zip code, so I'll continue to include this for y'all's historical data. Next is your county grants update slide. Starting next week, we're going to begin to show a slide on this that takes out the court approvals that y'all have all approved for the submittal of grant applications that maybe have not been approved yet or are still in the queue for whatever reason. But this way we can show you all what has been pulled out. What you all have approved, and it'll be in a nice format. The amounts are subject to change if maybe we don't get it awarded or something happens. But just for instance, right now, public health has approximately 43 million sitting out there that would be included in this tab that's waiting to be awarded, or the notice of award has been received and maybe just not moved over into this grant update slide. So we'll start that next week. Okay. And then last is your spend update. No new significant updates on this one. And I believe that is all I have, unless there are any questions for me today.
Questions?
I don't have a question, but I have a comment. I know that you had shared about the closing of the CRF program. And I know that there are so many efforts that we're working on, and it's hard to take the time to pause and to celebrate, but that's a huge win, the closure of that program. So I want to thank GK's team, the auditor's office, budget, IT. I'm listing departments at the risk of leaving one out, but I know that it was all hands on deck effort. And obviously the work continues with our other programming, and then even the ARPA money that'll be coming in, any day now. But that's huge. And I certainly think that the community is starting to significantly feel the impact of our efforts. So I just want to encourage all to keep up the great work. So thank you.
Thank you.
Thank you, Megan.
You're welcome.
Mr. Mania.
Court members, if we could now go to the update by the Health Science Center. Dr. Trent Adams is here to begin the presentation. Good morning.
Good morning.
Good morning, Doctor.
Morning.
Good morning, Judge Whitley, Commissioners. It's a pleasure to be back with you again today. My colleague David Mansdorfer and I will be providing an update today on the vaccine partnership between UNTHSC and Tarrant County. So let's get started here. The snapshot of our activities to date. We have 2 active vaccine sites. As you know, we've updated you previously on the site at both the location in Ebenezer as well as our site in Saginaw. We have seen some decrease in activity at both those sites, but it's a trend nationally. The demand for vaccines is actually decreasing across the country. We're hoping that our vaccine outreach efforts will increase those efforts going forward, as well as requests for new sites as we have planned. We have Site 3 active as of tomorrow. As Megan indicated earlier, we do plan to open Ridgemar Mall tomorrow, and that site will be the newest addition to the other 2 sites. That site will be open Tuesday through Saturday from 11 a.m. to 7 p.m., and that is to accommodate some of the concerns we heard from the community around the flexibility of hours not being conducive to their schedule. So this will help those individuals who may not have been able to get there during the work hours of the day, and will give them some flexibility on the weekend as well as late in the evening. Moving on, we see that Site 3 will be active tomorrow. Site 4 is planned for April 26th, and we have a site visit scheduled and that's UT Arlington. And I think, Commissioner Allen, we've had some conversations with you and your staff about that site as well. Future sites are being identified and vetted with the community. We want to make sure that we're providing the right size sites. As I mentioned before, we've seen a decrease in demand for the vaccines in some locations, but we want to make sure that we start to cater to the community need. So there might be microsites or pop-up sites just to be able to address those specific needs in underserved communities.
Dr. Trent Adams.
Yes, sir.
In that regard, have you considered going to walk-up on-demand service?
So that is a part of our plan going forward. We realize that some people don't have access, as we know, to the internet. They may not have access to telephones, and walk-up and on-demand sites is a part of the way forward. So yes, we will be doing some of that. And that will be a part of the plan for the microsites. In addition to which, as we've been talking about the homebound efforts, we have now been able to negotiate with MedStar. We will be finalizing an agreement with them, and we'll also be working with, we've been working with Chief Davis from Fort Worth, City of Fort Worth as well, to identify the need from what they've been doing, and lessons learned from them will help to inform our processes. We also met with many stakeholders across the county who serve homebound patients, such as Meals on Wheels, also some of the stakeholders from United Way. I had a call with Catholic Charities last week to make sure that we understood what they were doing and how we could be of benefit to them. So it's going to be a collaborative effort. A lot of the homebound patients that we've identified thus far we've received lists from some of the faith-based organizations in the community. So we'll start with the list that we already have. We'll work with those identified that have not been able to be served by Meals on Wheels. They have served, I think, approximately 250 individuals who received the J&J vaccine. We also reached out to Carla to ask her if there are others on that list that need the vaccine. Let us know. We will take care of making sure they get both of the doses that they need. In the event, because we have a pause on the J&J right now, we don't know what the outcome is going to be with CDC and the federal government by the end of the week. So we want to make sure that if we prioritize those as well.
MedStar's contractual scope is not countywide.
Right.
Are they going to be able to deliver these services countywide, or do we need to partner with other agencies in order to get countywide coverage? It's important that it be countywide.
Well, Commissioner Allen raised this in a conversation we had with her around Tarrant County and also some of the homebound population. So we actually are using our pediatric mobile clinic at HSC to provide services Tarrant County wide. We're also working with some of our staff on site who have been doing this as a part of the mission at HSC. So those areas that need to be reached that are outside the scope of other providers, we will cover that with either additional agreements or internally with the pediatric mobile clinic, who will be serving not just pediatric population, but the entire population, as well as a geriatric program at HSC.
Thank you.
Yes, sir. And moving on, to date, as of April 16th, we had delivered 3,033 vaccines administered that week. That week, a total of 3,000 vaccines, over 3,000 vaccines have been delivered. Registration drives, we have 15 that have been completed, and another 13 are scheduled. And we have 3 voice listening sessions that have been completed to date. We've learned a lot from the voice sessions with the community. It's helped not necessarily to identify new information about vaccine hesitancy or communication skills that are needed, but it has validated for us where we see there have been challenges. A lot of the challenges that were raised by Tarrant County, specifically Vinnie and GK, as we started to go through this whole process, have been validated by these focus groups. So it's good not necessarily to have new information, but definitely to validate our approaches are on target, but also to make sure that we are aware of what challenges continue to persist over time. So that ends my portion of the update. Any questions on that thus far?
No, I think
Judge Whitley?
Judge Whitley?
Dr. Adams, is David going to talk about some of the other attempts or other ideas y'all might have as far as how to expand, like maybe working with churches or working with community centers or stuff like that?
Yeah, David will cover some of that, sir. And if there are other questions specifically, I'll come back up at the end of his presentation to take those questions if he does not cover everything you want to have answered.
Okay, thank you very much.
Great. Yes, sir. Thank you. David?
Good morning, David.
Good morning. How are you all today?
Very well.
Good. So my portion of the presentation will focus mostly on the marketing community engagement side of the equation. The map you have in front of you is a list of all of the billboard locations, gas pump, and posters that we have acquired throughout Tarrant County. Hopefully you all have started to see some of them pop up out there. I know in a conversation with Commissioner Allen, she had at least seen one of ours. The blue, or the hard blue in there, is the billboards, and the green is the gas stations. So you'll see a pretty decent saturation throughout a majority of Tarrant County, and this is just kind of the hard fixed assets that we have been working with. They are the direct to getting registered, and in partnership with GK and his staff, making sure that they have access to all of the different vaccine locations within Tarrant County, whether it be in Hearst, whether it be ones that HSC runs or come online in the future. These are some of the paid social media ads that you'll see. Again, these are in 3 different languages, so this is just the English version that you see in front of you. Predominantly Facebook, Instagram, and Nextdoor. I don't know if you all are aware, but Nextdoor is a great community-based app that gets a lot of interaction and traction. So all 3 have been live, in addition to streaming on different services, as well as radio is going live as well too.
Like traditional radio?
Yeah.
Okay.
The door-to-door kits are available. I brought some sample door hangers in the 3 different languages. We have several 100,000 of them that we can distribute. We're working with our community engagement office to find out a way to do that in a good way. We have many partners that we're just going to drop them off and they are going to do it. So that's part of the relationships I believe the judge was asking for, where folks can get some of these delivered to their facilities or come pick them up from us, and then they can go distribute them in the ways that's natural to their organization to engage with their consumers or their benefactors. So they're good. I'll leave them. They're in English, Spanish, and Vietnamese. So we have 3 different modifications. And again, as we get into more of this demographic subpopulation where we're trying to reach, we have the ability to pivot them as well too into some specific languages within certain communities as well too. And we look forward to doing that. Again, going back to the registration activity, 15 registrations already done, 13 more concluded. We're partnering with different offices, different areas. Again, a lot of folks have been very supportive, whether it's, as Dr. Trent Adams said, the Catholic Charities of the world. I know UTA has been very supportive of something that we're trying to do over there. Ridgemar Mall gets a lot of foot traffic, so that should have a lot of positivity. Again, going back to the conversation about signage, we are directional signage is very important on a site like Ridgemar Mall, to make sure that folks get to the appropriate location. And again, Ridgemar might be one of the best opportunities to really try out that on-demand walk-up service, because if you're just walking past, it may be a good opportunity, as opposed to some of these other sites that are you're not naturally going past on a day-by-day basis. So again, that's all within our modeling to try and do and progress. We're starting Ridgemar Mall rather large. We have 6 teams slated to go over there, but we will look at the trend lines for vaccine distribution for who's actually the demand side of the equation, to see how big of a team we keep over there at any given time. So the initial shock of folks, if there's a huge demand, we should be able to take it over in that community. And then we'll scale back if necessary, if demand starts to wane, as we've seen in other locations. And then back to the site updates again. Stop 6 in Saginaw. Second shots are beginning, so we're starting to see the trickle through of round 1. And then, as Dr. Trent Adams mentioned, in working with our partner OptumServe, we have definitely seen a decline in demand across the board, and that's not just a local issue, that is a nationwide issue in the areas that they are also working. So again, hopeful that our marketing efforts continue to help drive support our community partnerships. But we're going to be looking at assessing the modeling and how we do this to make sure that we're doing it in an efficient and effective way, and that we're not necessarily just having significant assets sitting out there that are going underutilized. So that's my portion of the presentation. I'm happy to take any questions.
Yeah, David,
as far as the,
go ahead.
I mentioned churches. Are there things that, if a church, for example, would like to set up a time to have y'all there and their parishioners come in and be vaccinated, should they be called? And I had mentioned this to Benny earlier, and I want to make sure we've coordinated who they need to call. Right now, I think we have them calling the number. Maybe another couple of things is to look at big events and check with the event sponsors and see if there's any way we could have an area set up to vaccinate people at those, the next Ranger home game. If we could, if Johnson & Johnson is back on the line and we could vaccinate people there, And maybe in some instances, people would, our event planner might say, okay, you can come to the event for free if you'll get a vaccine or if you've been vaccinated while you're there, just as an incentive to encourage people to get vaccinated. I really want us to kind of begin thinking out of the box because, we are getting to the point now to where we don't have the white lines and, I know the state's interested in continuing to get more and more people vaccinated. I had a message from Chief Kidd this morning, just saying if there's anything they could do to help. He was, more than willing to help, and I think they have available vaccines. We're kind of at that point now to where, truly we've got more vaccines than we have the folks who are interested in getting it. So if we can think of any innovative ways to encourage people to get the vaccines, I hope we'll do that.
Absolutely, and the thought process is you're going to start to see things like the pharmacies come much more active. I know there's been a lot of hiccup. They were predominantly a location for Johnson & Johnson, and with that, that's kind of hitched up a lot of their activity. But as you see it get more saturated into the type of provider that can administer, whether it's your primary care physician, whether it's your hospital, which I know has already been doing it, but in a much greater extent, and then also your pharmacy, there's probably, it's going to more naturally go to where the market has historically administered vaccines. And so what that will allow us to do is really pivot towards some of these underserved communities and allocate resources there. But also specifically focusing on making sure that we are addressing areas and pockets of opportunity. So if we have the ability to work with some of these large venues and have the ability to do a Johnson & Johnson or something like that, that's part of the mobile solution that we're trying to work on. So it really just becomes opportunity, vaccine availability, and then partnership.
David,
maybe another idea would be, as the county does the flu shots, maybe we could see if we set a day aside to give the vaccines. Folks could, sign up or come up. Mr. Manius, Vinny, y'all might want to think about something along that type of lines. See if we could do that for any county employees, or maybe we set a day up downtown and just say, we're going to be open from this time till this time, and whether it's the Plaza building, whether, wherever we might want to do it, and just try to encourage people to come if they would like to get vaccinated, or go into the big buildings and see if they would give us a room. We just really need to begin trying to go where we know people are and see if we can, see if they'll come down if it's that convenient.
Yeah, I agree with you, Judge. I definitely want to see us get to that point, knowing, especially with J&J currently not being an option, if we do a sign-up event and then someone has to show up for their first vaccine and their third vaccine, those 3 occasions where they're having to maneuver their schedules and take time off from work and things like that to try to get vaccinated, versus if we could do pop-up, same day, walk up, get vaccinated, and you're done.
I know that several of us have submitted to you names of churches and other facilities in our precincts that would be available for pop-ups. I'd like to see y'all go to some of those.
Absolutely. We're in almost a second modeling phase, because we've kind of hit what I think is the fixed sites, and I think we've seen that come out of the federal government as well too. A huge de-emphasis away from large fixed sites because of the lack of demand, the lack of accessibility issues for some of the groups that we want to reach. So we're almost in modeling phase 2, which is to make sure that we can figure out the best and most efficient use of what you all have bestowed upon us to help all of Tarrant County.
Yeah, David, so in the map that you showed where your billboards and the gas pump marketing is this a partnership with a particular company or grocery store chain or whatever? Because I'm seeing some gaps, especially what I know are like the persistent zip codes in Precinct 2, so 76010, 014, and 018 that either, that have had kind of low saturation in vaccine signups and numbers. So it just seems like there's a gap there, but I don't know if that's based off of how y'all approached who you're partnering with.
I can provide that information on the back end.
Okay.
It's a typical billboard buy, so there's only a couple companies that really
do
work
it anyway.
on that.
Okay.
And then there's only certain gas stations that work within the realm of the program that we're working with. So we do have the ability to go in other avenues as well too to shore up some of our areas.
Yeah.
And you'll see this map change a little bit as we go over the course. This is just what we could
Just
get
the first
really
picture.
quickly.
Gotcha.
And as big as possible. As you see, we try to go as big as possible.
Yeah.
To saturate all of the different areas. So where a majority of the Tarrant County residents, again, our hope was, oh gosh, I didn't bring this number with me, but I wanted to say it was 120 to 130 million impressions that we were hoping by the end of what we did here.
Okay, very good. Thank you.
Thank you, David.
Thank you.
Thank
Any
you
other
all.
questions? All right. Thank you, David.
Thank you, David. Appreciate it. Members of the court, we can now ask Mr. Tanasia to come forward and to begin his presentation.
Thank you, Sylvia.
Good morning, Commissioners, members of the court.
Vinny.
We'll go through our briefing here for COVID-19. So a couple of things I wanted to point out. Eastern part of Trauma Service Area E, the TSAE, the 19-county region, as you can see, it's starting to change colors a little bit, getting a little disease activity in their hospitals. But overall, the picture has not really changed. We've come down significantly and we've flattened out. And the flattening of the curve has been there for almost 4 weeks now. So we've quit going down. That's the key thing to understand, that we're not going down anymore. The total number of cases are 255,000. Deaths are 3,378. We're at about 3.84% in hospitalizations in Tarrant County. So week over week, that's actually a little bit of an increase. But overall, the trend, looking at January, we're still in a big picture downward trend. It's just that we kind of hit our bottom and we're flat there. And then ICU people did gone up maybe a smidgen, 2%. I think we were at 11% last week. Now we're at 13%. Not that I'm too overly worried about it, just very cautious of why this is happening, because once you're in a downtrend, you want to stay there. Same thing with the trauma service. They've gone up a little. They took away our bar chart at the DSHS website. Now it's a line chart. Not any more easy to read. It just, there's not enough data to view the big context, but it is what it is. So here's the trend charts in Tarrant County. The left chart is the actual epidemic curve on how the disease is progressing in the community. As you can see, last several weeks we've been just flat. And the numbers aren't going down, they're just holding there. On a daily basis, you could go anywhere between 150 to 250 cases. So let's call it an average of a couple hundred a day. Deaths have certainly declined. We're down to 1, 2, 3 deaths being reported. So that's coinciding with what we saw in the decline with cases. Here's all the other indicators. The one that I very closely watch is the positivity rate. It's been hovering between 5 and 7%. Currently, we're at 6%. So we've been in a flat trend for the last 3 or 4 weeks. COVID-like illness is hovering around at 1%. Again, flattened out. Hospitalizations we've talked about, they're flat. The case rate on the right is at 62 per 100,000. That's gone up a little bit over the last couple of weeks. We were down to like 52 per 100,000, so it's gone up a little bit. And the R naught remains at 1.01. So at the low, we were at 0.53. So for every one person, we were infecting a half a person. But now every one person's at least infecting another person. So the virus has accelerated a little bit in the community, the spread has. But overall, I think one is sort of the number that we watch. If you're above 1, there's a little bit of an increase in activity. So we're right there. So here are national trends in what's happening with the cases. As you can see on the left-hand chart, that's the U.S. data. It's showing a surge in activity over the last few weeks. This particular week it has slowed down and there's been a relatively low 5% increase. But we're coming off of 14%, 18%, 11%, 5%. So the last several weeks have shown increases consistently for 3 to 4 weeks. Now, if you look at the charts real carefully, we're at July-like peak levels. Hopefully that's the peak and then we continue to resume our downward trend. But what worries me is things like what we see on the right in Michigan. They had a huge surge of cases, and that is the lead state right now, but South Dakota is having similar issues. There are 13 states in the country that are starting to show upticks in activity. What I'm hopeful for is that I'm kind of starting to see a little bit of a peaking out in Michigan, and hopefully that will be the end of it, and we'll all come back down as a country. So those are kind of the highlights on the U.S. trends. Here's a global picture. The left top corner is the global chart. As you can see, worldwide we're peaking just like we did in the December-January timeframe. U.S. obviously we talked about. The bulk of cases are, again, coming from a handful of countries. India has a huge outbreak right now. As you can see, there's just kind of no end in sight there. But Canada, on the right corner, is pretty much, I think, beyond their regular peak, what they saw in December, January. They have the entire province of Ontario under a very strict lockdown. So things aren't good everywhere. I mean, you know, luckily we're catching a good break here in Texas, and we'd like to keep it that way. But this can happen anywhere, so we all need to be very, very cautious and do our part. And what is our part? Continue to wear our masks, maintain a 6-foot distance from others till we have widespread coverage of vaccinations, and then avoid large gatherings till such a time where the majority of the people are vaccinated, and continue to wash our hands throughout the day. So that's all the disease-related updates. If there's any questions on that, otherwise I'll switch to vaccines. Okay.
Judge, you good?
I think he's catching up on the slides.
Okay.
Okay, so here's the vaccine clinic schedule, and as you can see, our partner clinics are growing, so it's getting a little busy. But the highlight is that the FEMA operations at AT&T Stadium came to an end yesterday. So yesterday was their last day, and they were providing a vaccine there. So we're actually in talks with them to extend their stay. We have one approval from FEMA, I believe, and we're waiting on a U.S. NORTHCOM approval for the DoD contingent that's involved. But the idea is that their entire team is going to be able to move to Hurst to help us out. Currently, with the demand declining, I don't foresee a need for a 7-day operation there, so we'll probably maintain our 5-day-a-week solution there. So it is to provide relief staffing. A lot of those city fire departments that have been helping us do have other day jobs that they have to maintain, so we're hopeful that the extended team there, FEMA DoD team, could stay another month and help us out to provide some relief. And then you heard about the new sites going up. And this week there's a couple of MedStar operations that are mobile. They're actually addressing a situation in Haltom City. We've talked about the vaccine rate being low. So they're going to the American Legion, I guess it's the outpost, 655. And so they're going to be there. And of course, a lot of seniors visit that center. So, obviously that's a good location to try and get vaccinations done. And they're also going to Mount Moriah Church in Fort Worth, I believe this Friday. So those are two activities that are mobile activities that are planned. But again, overall, we're seeing what you heard earlier. There's a decline in demand for first doses. So we're going to continue to push, sign up and educate the public about the need to vaccinate. But it's an uphill battle from now on that you got to get, it happens when there's a scarcity, everybody wants something. And then when there's a, supply comes in, then everybody's losing sort of their interest. So we'll continue to carry on and hopefully get as many people as people want, we can get them vaccinated.
Here's the update on the situation from a coverage standpoint. 957,000 doses administered total, out of which 85% or 813,000 went to Tarrant County residents. And as a county, we're about 24% vaccinated, so about 509,000 people have at least one dose. And then about 15% of the county, or almost 320,000 people, have completed their series. So they've either had 2 doses of Pfizer or Moderna, or they've had some Johnson & Johnson 1 dose. I think the last I remember, there were at least 12 to 13,000 doses that I saw in the data that were given out. So it's not a huge number, but people have received Johnson & Johnson as well. And I believe there's another meeting this Thursday of the ACIP, the Advisory Committee on Immunization Practices. They're going to discuss again all the safety data that they find during this week and make a decision on what to do with Johnson & Johnson.
Vinny, at what percentage of vaccination in our community will we be considered to have reached herd immunity?
So that's a tough question. So it's kind of hard to say what percentage of vaccination. Vaccination and natural immunity from disease combined, when you start to get above 70%, you have that herd immunity effect. Where it's really effective is when you approach 90%. We've seen that with a lot of diseases. If you get to that 90% mark, a lot of times those diseases are eliminated. But after 70%, we get a protective effect in the community. So we've got about 250,000 people that we know have been positive. I'm sure there's people that we don't know that have been positive, and then you add in the vaccine. So we're making good progress.
Yeah.
I don't have a crystal ball to say when. My contention is that till we can get the kids immunized in our community, it's going to be a little bit of a tough battle to get herd immunity there. But once kids start to get immunized, I think we're going to be in a good shape.
So we're at approximately 24% right now.
At least 1 dose, 15% series completion. So yes, sir.
So we've got some serious work left to do.
Yes, sir.
Yeah.
And that's
But we still have those individuals who actually caught the virus and no longer have it, that have an immunity now that is not factored into these numbers.
No, sir. Yeah, this is just vaccine numbers. But the issue there is the declining interest at only about 15% series completion. That's low. So the message for everyone to repeat to anybody they meet, let's get vaccinated while the cases are low. Don't let your guard down because it can surge. Examples abound all across. We've seen those. Let's get vaccinated.
One, I wanted to be sure to add, I know that in previous weeks I had expressed the concern about what happens when the FEMA site goes away, right, because they were primarily providing the J&J and making sure that we had a regular mass vaccination effort in Precinct 2. So last week there was conversation about Cornerstone Church and that it was fully vetted, and that's just not a good opportunity right now, but that we are working with UTA and other efforts to make sure that we are keeping the vaccine distribution equitable geographically and otherwise, and focusing on some of our hardest hit areas. But so obviously the week over week, the more numbers that we see, and it provides a clearer story, a more clear story, is, you know, the hardest work is still yet in front of us to make sure that we are connecting with folks and responding to their concerns and ultimately helping to get them vaccinated.
Yes. Yeah. And it is becoming more convenient, as you heard, that people can now choose a clinic of their choice. They can pick a time. You all heard the discussions about going mobile and bringing vaccine into the community. So all of those efforts are, once the initial sort of rush of people coming to you sort of starts to fade off, you go to the community, bring the vaccine to them. You know, when a lot of people are coming to you, your staff are stuck there, they can't really go. Slowly, I think we're going to be able to peel off and get into the community. We will get there, but it's not an easy task. It's just going to take a lot of time and a lot of effort from all of you, educating the public saying they need to get vaccinated.
My message for the past couple of weeks has been directed towards parents, grandparents, aunts and uncles of kids 16 and above. That is a very hard to convince population. So we need to hit them hard.
Just a couple of quick slides. So here's all the sign-up data. As you can see, there's still gaps in sign-up rates. Central part of Fort Worth, eastern part of Arlington. Things are improving, so I don't want to mislead you that it's not improving. The efforts are paying off. I know a lot of you have put in your own personal efforts in getting people signed up. There is effective change that we can see, but till majority of the public signs up to get vaccinated, I'm not going to rest. I know that. So we want the public to sign up and get vaccinated, whether it's with us or with another provider if they're convenient. They just need to get the vaccine. And the final slide here is all the race, ethnic distribution, age groups. Again, improvements on all sides. I've pointed out that the ethnicity data is going to remain probably unknown for a long time. But even there, we see a 1 percentage point increase. So that makes me excited because look at the denominator. We're almost 957,000 doses. And if there's a 1 percentage point increase, that's a huge increase week over week. So things are improving. And then the final slide here is the summary of all the breakdowns between us, Arlington, and our other clinical partners. And another thing I want to point out, in our database, there were a whopping 700 people pending any appointment as of last night, and mostly those came in over the last day or so. And that's also people not choosing carefully. They should have and could have gotten an appointment at their choice. They just chose not to pick an appointment. Give me an appointment. Okay, that's fine. So things are in kind of a mixed bag.
Vinny, as people are looking, maybe, we've talked about the churches and groups. Is there a minimum size that you would like to have before you send out some sort of, or you schedule a mobile event?
So you're talking about the churches reaching out or other large employers reaching out for on-site vaccine sign-up?
Yes.
Yes, sir. So the call center is aware that there could be calls coming in, and I think I might have mentioned earlier that there's a area in our database that we record such requests in. Currently, we had it only internal, where we would get a call and we'd log that in. I think we had received about 10 or so requests. We had shared that data with UNT as they were compiling all of that. But we've had conversations yesterday about making it an external sort of a form to fill out, where anybody, whether it's a church or an employer or a large group of any kind, can go in and make a request. There would be certain questions they would answer about their capabilities on site, because some of them have their own employee health programs, and they might be just good partners to give vaccine to if they can handle all of that on their own. And some may need a team to come and assist. So we'll gauge all of those questions through the website, and then we'll make a determination and a plan on how to get those addressed. May not be all through public health, maybe through partner entities, but we'll keep working on it.
So the question was, is there a minimum number of people that you want to say, okay, if you're talking about 10 people, we're not going to do it. But if you're talking about 100 people, then we'll consider it.
Yes, sir. So there's some discussion about that. Currently, I think we're talking about a minimum of a couple hundred people, because as you've heard from UNT and several other entities, their teams, when they mobilize, they go with a goal of at least 200 for the day. So if they're going to go in for a day, I think 200 is probably a good number, 200 to 250.
Okay.
Yes, sir.
So, Judge, I just wanted to tell you, your voice is a little muffled, so you're kind of hard to hear.
Well, I had been told earlier that I was a little loud, and I have heard that before in my life. So I can get back to the louder normal me if you would like.
Yeah, use
I may
your
regret saying this,
voice.
but yes.
Okay, I'll go back to my outside voice, and we'll see if we can't make it work.
Thank you, Judge.
Mr. Manies, you had a comment earlier.
Not anymore.
Okay.
I'm going to pay for that.
All right.
Is that it, Benny?
Yes, sir. That's it.
Any other questions? Thank you, Denny.
Thanks, Vinny.
We do have one audience participation from Ms. Joanna Cardoza. Ms. Cardoza? You know the drill, Ms. Cardoza. You have 3 minutes.
Pull that mic down.
And GK, would you operate the clock, please?
Yes, I will.
Okay.
Go
Good
for
afternoon. Okay. Good afternoon, Commissioners and County Judge Whitley. My name is Joanna Cardoza. I live at Precinct 2. I am here today to continue to advocate for my community in regards to vaccination efforts. Last week, I witnessed a loved one take his last breath after being disconnected from life support after battling COVID-19 for several months. I ask that public health continue to look into its communication strategy that is inclusive and considerate of the community it serves. We need more information going out to the public for vaccination appointments to be sent in multiple languages. Some of the channels presented, I'm saddened to see that the vaccination rate in East Arlington is one of the lowest in the county. I would like to see a one-day pop-up vaccination event just like the city of Fort Worth has been coordinating in underserved communities in Arlington. I just heard about UTA. That is kind of concerning to me because I don't think that that's in a good area that would serve the East Arlington community. I think that needs to be looked at. Many underserved communities consist of hardworking families, and I think the county needs to look at setting up vaccination sites that operate after 5 o'clock. We need to make sure that we do not forget those in our community who cannot physically get to a vaccination site. I myself was one, after months of battling a health issue and an injured knee, I am finally able to come before you instead of calling in. We must not forget those with chronic health issues, our older population. I belong to many moms groups in Arlington and Mansfield, and I see many posts of adult children trying to figure out how to get their homebound parents vaccinated. The Tarrant County Resource Center had a long line the day I went to get vaccinated. Although the majority of the people working at the site were very friendly, no effort was made to help me due to my injured knee. In closing, I would like to bring an issue to your attention since I know that you care deeply about the way Tarrant County treats its residents. I do not believe that Constable T. Kane is the right person to be dealing with the public at the Tarrant County Resource Center. He is very rude and not very friendly at all. It is unfortunate that everyone else at that location is so friendly and one person makes the vaccination experience very uncomfortable. I like the capability to make a reservation for a place and time that was just mentioned. My mom is not very happy about having to go to Hearst after getting vaccinated at the Tarrant County Resource Center. Thank you for your time.
Thank you, Ms. Cardoza.
Thank you.
Mr. Manius.
Members of the court, that is all we have on item number 1. If we can now move to item number 2, we're requesting that the Commissioners Court approve a legislative policy statement supporting local options to encourage registered voter participation in elections and increase state funding for elections.
This is a legislative policy statement, so it will require a unanimous vote by the court in order to become effective. I believe this is important to protect our local options, to have early voting sites, to have, what do we call it?
Vote centers.
Vote centers. Yeah. Those should be local decisions and not Secretary of State decisions.
I agree. It requires a motion for action, right?
Yes, it does.
So I move for approval.
I'll second the motion. Any discussion? Please vote. Judge Whitley.
Yes.
Commissioner Johnson,
Yes.
Commissioner Fickus,
He is on mute.
Commissioner Fickus, you're on mute.
Yes.
Thank you. The policy statement passes unanimously. Thank you, Mr. Manius. Ms. Tidwell. Anyone from the auditor's office present? GK, you want to handle this auditor's item?
Absolutely. I'm sorry, we wanted to talk to Mr. Cordova also because we have some suggestions.
Great. Thank you.
Members of the Court, we can go to the auditor section. As you see in your agenda, we're requesting that Commissioners Court approve the release of depository collateral.
Move for approval?
Second.
Second.
Please vote. Judge Whitley.
Yes.
Commissioner Johnson.
Yes.
Commissioner Fickus.
Yes.
Passes unanimously.
Thank you, Commissioner.
Human Resources, Ms. Glenn.
Move to receive and file the personnel agenda.
Personnel agenda.
Second.
Please vote.
Do you have any?
Judge Whitley.
Yes.
Commissioner Johnson.
Yes.
Commissioner Fickus.
Yes.
Go for it, Ms. Glenn.
Good morning. It's nice to
Good
be so
morning.
popular. So we have 3 additional items for the courts. The second item, we're asking the court to approve changes to the sheriff's table of organization. As described in your court communique, this is a request actually for 3 items. The first is the addition of a human trafficking task force commander effective April 24th. There's also a request for the addition of a full-time chaplain's position that's effective May 8th, of course, if the court approves. And then finally, the reclassification of a detention officer to a detention corporal. That too would be effective May 8th. Just as a couple of important notes, that the commander's position is a grant-funded position. We're estimating the cost of that position will be around $152,000 and some change. That does include fringe benefits, the chaplain, as well as the reclass of the detention officer position. Those actions would be covered by commissary funds. So again, no impact to the general fund, and the sheriff is present if you have questions for him.
Move for approval?
I'll
Second.
We've got a motion and a second. Any discussion? Hearing none, please vote. Judge Whitley.
Yes.
Commissioner Johnson.
Yes.
Commissioner Fickus.
Yes.
Motion passes unanimously.
So our next item, actually the next 2 items are waivers. The first is from the auditor's office. Ms. Tidwell is requesting a waiver effective April the 21st. Her financial accounting manager, Ms. McKenzie, retired on April the 16th. So the request is for 384 vacation hours. We're looking at a net cost to the general fund of approximately $4,800. That does include fringe benefits.
Move approval.
Second.
Motion and second. Any discussion? Please vote. Judge Whitley.
Yes.
Commissioner Johnson.
Yes.
Commissioner Fickus.
Yes.
Motion carries unanimously.
And the final item, as mentioned previously, is also a waiver. This one comes from the Criminal District Attorney's Office. This request actually is comprised of 2 requests. So we're requesting 2 waivers, both effective April the 22nd. These are managing attorney 1s who've left county service. We're looking at a combined waiver request of 606 vacation hours. That's between the 2 positions. We are looking at a net cost to the general fund of approximately $18,000. That does include fringe benefits.
Move for approval.
Second.
Motion and second. Any discussion? Please vote. Judge Whitley.
Yes.
Commissioner Johnson.
Yes.
Commissioner Fickus.
Yes.
Motion carries unanimously.
Thank you.
Public Health, Benny.
So we have one item for your consideration this morning. It's the request for approval to submit an application in response to a request for applications from the Center for Disease Control and Prevention. This is a COVID-focused grant, but focused on health equity. It covers everything from contact tracing to testing to vaccinations. It's a large grant.
Move for approval.
Second.
Have motion and second. Any discussion? Please vote. Judge Whitley.
Yes.
Commissioner Johnson.
Yes.
Commissioner Fickus.
Yes.
Motion carries unanimously.
Thank you.
Thank you, Vinnie. Commissioner Johnson, you have an interlocal agreement.
Yes, has this been approved by the DA's office?
Yes, it has, Commissioner.
Move approval of item 8K, 1A and B.
Second.
Motion and second. Any discussion? Please vote. Judge Whitley.
Yes.
Commissioner Johnson.
Yes.
Commissioner Fickus.
Yes.
Motion passes unanimously. Mr. Manius.
Thank you, Commissioner. I do want to make a comment before, we need to see where we can put this in the record. Since we've had 3 court members that are not physically present, and Commissioner Brooks has been chairing the meeting today, when anyone looks at the board, the vote that goes for Judge Whitley actually should be registered for Commissioner Brooks. Okay, thank you.
Any appointments to various boards and commissions today? Any bonds or certificates of self-insurance? Now we move to the claims, including the addendum.
Move approval.
Second.
Motion and second to approve the claims, including the addendum. Please vote. Judge Whitley.
Yes.
Commissioner Johnson.
Yes.
Commissioner Fickus.
Yes.
Motion carries unanimously. Briefing agenda, Mr. Manius.
Thank you, Commissioner. We have one additional item to discuss or talk to the court about. That concerns actions of the Texas legislature. As you know, they are in session. I believe we have about 40 days to go yet before they sine die. Mr. Schaffner has provided a memo to each of the court members, which was dated April 16th. It talked about several different items. The first one deals with the state budget. It is the most important and the only bill that the legislature is mandated to pass. And it's already moved through the Senate, and there have been a large number of amendments on that on the budget bill when it went to the House. I believe over 200 amendments. So we're still far from clarity as far as what the budget is going to actually look like. We did talk with them somewhat about trying to, I think we were successful in having money restored to for mental health. I think there was a shortage of $30 million that from last year, and we have had that placed back in the budget in the House version. So on Senate Bill 10, this is the taxpayer-funded lobbying. I can go into this, but you can see by the memo that's in your file and in your book that we are still working diligently to try to improve that particular bill. The Senate Bill 21 and House Bill 20, which was bail reform, it's moving forward, but the legislature still has not come to any general conclusion as to what type of bail reforms they are actually seeking at this time or will be able to pass at this time. One of the things that is of significant interest to the county is the new class of benefits. And we've talked about that quite a bit. This is for certain law enforcement, confinement, public health related people, that there is a presumption that if they that actually a supervisor can make, and as it relates to quarantining some of our employees if they're exposed to any type of viruses. And we're still monitoring that and working aggressively to have a lot of that responsibility fall on the public health aspect of the county to make those determinations rather than merely a supervisor in one of the departments that would be affected by this. Unfortunately, it has come out of the House, and it's a pretty strong bill. We're going to have to work to see if we can reach consensus on some areas, because if not, we see this as a major funding and a permanent funding responsibility for the counties. The other ones that are dealing with the law enforcement funding legislation, we've been fairly successful in removing counties from that because of how counties are structured and the different functions, law enforcement and detention functions that the counties actually participate in. And Tarrant County has continually provided adequate and increased funding for our law enforcement personnel and confinement personnel, and so I believe we're going to be successful on that particular bill. You can look at all of the other ones. The fireworks legislation, the one that concerns our office a lot and the fire marshal's office, and is House Bill 3967 by Cortez. This would restrict the county's efforts to sell fireworks in a drought or in the month of December. And as you know, those are the months that we have a significant number of grass fires. And since fireworks can be discharged out in the unincorporated area, we need to make sure that we are opposed to that particular bill, and also that it does not pass. You can see the other election items that are in that memo, and I'll be more than happy to attempt to answer any questions that you all may have on this particular issue.
Any questions on the legislative agenda? Hearing none, is there a need for an executive session today, Mr. Manning?
Not today, Commissioner.
Well, it's been fun. I want to thank Judge Whitley for the honor of presiding in your stead this morning. Hope you and Commissioner Fickus have traveled and are traveling safely. And Commissioner Johnson, thoughts and prayers are always with you.
Thank you.
Good job, boy.
There being nothing else to come before this body, we stand adjourned.
Thank you.